Senior Moments is brought to you in part by Rogers City Rehabilitation Hospital, Hillman's Haven, Alpena Cab, and Alpena Medical Arts.
Dementia is a degenerative disease that affects the brain. There are many different types of dementia, some of the most common forms being Alzheimer's disease and vascular dementia. Dr. Carol Copenel explains that the cause of the disease usually determines its kind.
Primarily the cause. So with Alzheimer's disease, we do know that that can be inherited. And there are certain families that specific gene has been identified in.
Dementia is a disease that is popular amongst the geriatric population, but Dr. Copenel says some people can show early symptoms at a fairly young age.
Actually, because it is a degenerative type of illness, it affects older populations. Although as I mentioned, the families with Alzheimer's disease, some of those people will develop signs of severe dementia by the time they're in their 40s. That's pretty much as early as it would come on, and it becomes more and more common as you reach 60, 70, 80, 90.
The disease usually develops slowly over time, which means the early symptoms are subtle. Those symptoms include forgetfulness, losing train of thought, or just having odd behavior. Dr. Copenel says the symptoms will become more consistent and eventually very severe.
In the end stage of dementia, all dementia, people begin to have difficulty even carrying on a conversation, making sense. They're really not able to take care of themselves normally anymore.
With so many overlapping symptoms, it can be hard to determine the type of dementia the patient suffers from. Doctors can use brain scanning techniques to help diagnose the patient's type, but it isn't always successful.
Senior Moments has been brought to you by Thunder Bay Therapy, ARMC Orthopedic Associates, Lafarge, Alpena Senior Citizen Center, and Lincoln Haven. Senior Moments, Thursdays at 6 and 11.